Okay, so what are you in here for today?
I've had a headache for several days now, and my body aches, and I just feel really congested.
Okay, so you have the flu, so I'm just going to write you a prescription, and I'll see you in a couple weeks, okay?
Okay.
Okay, so what brings you in here today?
I haven't been feeling well the last couple days. I have had a headache, and my body has been aching, and I felt really congested, and I just haven't felt good at all.
Have you had a fever with your headache or anything?
I'm not exactly sure. I might have, but I haven't taken my temperature or anything.
Okay, do you have any sore throat or maybe a cough?
Definitely.
Okay.
Yeah.
So I'm going to do some tests and look at you, and we'll figure out what's going on, okay?
So what brings you in today?
Well, I've been having pain in my abdomen and my joints and my lower abdomen really bad and some bloating. So before I came, I made sure I looked up what my symptoms could be, and WebMD says that I could have Crohn's disease. So I want to know how we can fix it because I am really tired of being uncomfortable and having diarrhea. So what can we do?
Well, if WebMD says you have Crohn's, then you probably have Crohn's.
So what do
So I'll just write you a few prescriptions and send them down to Kroger.
But like
Pick them up later today.
But
Have a nice day. So you're back.
Yeah, I'm still pooping. I still am bloated. I'm still having pain in my abdomen. So we know that I have Crohn's disease, but we don't know what to do to fix it or...
Well, we established that you had Crohn's and you had all of the information there on WebMD. And I gave you a prescription, so I'm not sure what else I can do.
Well, WebMD also told me that a doctor is supposed to give me a colonoscopy, so...
Well, I'll give you one of those if you want one. Next week.
Is that it, or...
Yep, that's about all I've got. See you later. So what brings you in here today?
Well, I've been having some really bad pain in my abdomen. I've also been bloated a little bit, and I've kind of been having really bad case of diarrhea. And WebMD says right here that those are symptoms of Crohn's disease, so I need to know if that's what I have, if we need to fix it, like what can we do?
Well, I understand your concern, but before we diagnose you with anything, we need to run a few tests.
Okay.
I'm going to schedule you for a colonoscopy next week. That's kind of an uncomfortable procedure, but it'll give us a better look at what we're dealing with, so that we can possibly diagnose you, or hopefully don't have to. Hi, it's great to see you back.
It's great to see you too, Doc.
Yeah, how are you feeling?
I'm still feeling a little under the weather, but I know things are going to get better since we've done my labs and stuff.
Yep, well, your labs came back negative for Crohn's, fortunately. It just looks like you had a case of irritable bowel syndrome, or IBS. It's pretty common and easily curable.
Okay.
Here's some information regarding IBS and diets you can follow, vitamins you can take that might help. I'm also going to write you a prescription that should help
Okay.
with your symptoms.
Okay. So,
Do you have any questions?
no.
All right.
All right. Thanks, Doc.
You're welcome.
Okay, so to avoid ineffective meetings like this, here are a few tips. Tip number 1, as the provider, be sure to face your patient and to be nice to them. They're probably very uncomfortable and nervous to be at the doctor's office in the first place. The second tip, as the patient, be sure to speak during the visit with your doctor. You want to make sure that you fully understand what to do because your health depends on your understanding. The doctor's being paid to help you, so make sure you ask questions when you have them. Here are some more tips to avoid ineffective meetings. Providers should also ask their patients if they understand what they're supposed to do, or even ask them to go over the regimen in their own words so the patient fully understands what to do. Doctors should also make sure to fully listen to the patient and run tests to make sure that they give a proper diagnosis.